Assalamualaikum to everyone. So our topic for this BIO270 case study assessment is motor neuron disease. So what is motor neuron disease? Motor neuron disease, MND, also known as amyotrophic lateral sclerosis, ALS, is an uncommon condition that affects the brain and nerve. With MND disease, messages from the motor neuron gradually stop reaching the muscle. This leads the muscle to weaken, stiffen, and waste, which can affect how you walk, talk, eat, drink, and breathe. Some people also get changes to their thinking and behavior, but the disease affects everyone differently. Research suggests a combination of genetic and environmental factors contribute to its development. Genetics play a role in about 5 to 10% of cases, while the majority of cases occur sporadically without clearly identified cause. MND is life-shortening and there is no cure. Although the disease will progress, symptoms can be managed to help achieve the best possible quality of life. Motor neuron disease, MND, causes a range of symptoms which progress at varying speed. This can appear in a different order for each individual, but you may be diagnosed with a particular type due to the way your symptoms appear. There are 4 main types such as amyotrophic lateral sclerosis, ALS, progressive muscular atrophy, primary lateral sclerosis, progressive bulbar palsy, flare arm and flare leg variant. The most common form of MND with weakness and wasting in the limbs, muscle stiffness, and cramps. This bar chart shows that how MND disease affects individuals based on their gender. There is 1 in 300 risk of getting MND across a lifetime. It can affect adults of any age, any gender, but is more likely to affect people over 50 years old. Dato' Muhammad Mokhtar bin Dari was a Malaysian professional footballer. He played for FA Selangor in his football career. He is considered a legendary footballer in Malaysian history. He was born in 30 November 1953 and died in 1st July 1999 at the age of 37. After 3 years battling the disease and his condition worsening, Mokhtar died at the Subang Jaya Medical Center. He was diagnosed with amyotrophic lateral sclerosis, ALS, types of MND.
The exact cause of motor neuron disease is not fully understood, and it is likely to be a combination of genetic and environmental factors. Other causes is oxidative stress, cellular dysfunction, and inflammation. Motor neuron disease get gradually worse over time. Moving around, swallowing, and breathing get increasingly difficult. As for Mokhtar Dahari, he began having throat problems and went to the hospital to find out what the problem was. Doctors diagnosed him as having motor neuron disease, with the discovery only being told to him and his wife. He then went to London with his wife in an attempt to cure his condition. After 3 years battling the disease and his condition worsening, Mokhtar died. Researchers have hypothesized that vigorous physical activity might increase exposure to environmental toxins, facilitate the transport of toxins to the brain, increase the absorption of toxins, or increase the athlete's susceptibility to motor neuron disease through added physical stress.
The symptoms of motor neuron disease might be: first, weakness ankle or leg. The individuals might trip or find it harder to climb stairs. Second, slurred speech, which may develop into difficulty swallowing some foods. Third, weak grip. The patient might drop things or find it hard to open drawers or do up buttons. The patient also may experience muscle cramps and twitches. Next, weight loss. Arms or leg muscles may have become thinner over time, and difficulty stopping crying or laughing in an appropriate situation.
Since we already know from the previous slide about how this disease occurs and what will happen if this disease occurs, of course there's gonna be some effects that happen and that will affect his life, and this is some of the examples that I can list, and there's 3 of them. It is mobility challenge, jobless, and communication challenge. As for mobility challenge, we already know that as this disease progresses, he will experience difficulty with walking and maintaining balance. For the next one is jobless. As this disease progresses, muscle weakness and the difficulty to walk can lead to a decline in physical abilities. Job that requires physical strength or extensive movement may become increasingly difficult to perform, especially for him, since he was a sport player that always need to do such a high physical activities. And the next one is communication challenge. As for those with the disease like him, communication might be challenging as the muscle connects speech are affected. He may experience slurred speech, voice change, and reduced speech volume.
Unfortunately, there is no cure for this disease. Despite that, there are plenty of treatments available to help relieve some symptoms of MND. One medication called quinine helps treat muscle cramps. However, it can cause side effects such as hearing and vision problems, tinnitus, and vertigo. Secondly, those with MND who have difficulty in swallowing, dysphagia, can undergo this common treatment where a feeding tube is surgically implanted into the stomach through a small cut on its surface. This shouldn't restrict any daily activities. Besides that, medications such as acetylcysteine and carbocysteine may make it easier to cough up thick fluids. Furthermore, ongoing clinical trials have found that the investigational drug tofersen has reduced harmful SOD1 protein and MND mutation in patients and has improved motor and lung function. This picture here shows Lindell Zinga, who after receiving her first monthly infusion of tofersen has said that its effect has been remarkable. Some aches were gone and her energy was back. To sum up, motor neuron disease (MND) is a devastating and debilitating neurological condition affecting motor neurons and resulting in a gradual loss of muscle function and control. Throughout this presentation, we have covered the causes, symptoms, impacts, and possible treatments of MND, and consequently on how our national treasure, Mokhtar Dahari, got inflicted with MND. With the collaborative effort between researchers and healthcare professionals in creating more miraculous drugs, there is definitely hope for the future. We thank you for your attention, and together let's keep raising awareness and providing support to those suffering from MND.